I have written a really thorough article on it.
Okay.
Again, that is, I think, as far as I know, it's on the website. If not, we'll make sure that it is there. It's called Paratyphoid Prevention is Better Than Cure.
Okay, Russ,
And
if you can just make a note of that so that we can try and put that up at
absolutely, yeah.
with the podcast here with the
With
doc. Yeah.
pleasure, yeah, we can find a way to get it on
Yeah.
there. Okay, and it's a thorough article about paratyphoid, and again, I'm going to try and limit it to 15 minutes, and go through the basics of it. And it's actually not such a difficult disease to understand. We don't have all the answers because, as I said, we have a major challenge vaccine-wise. Okay, but
Yes.
we'll get to that. So essentially, we have got to understand that when you're talking paratyphoid, it is the disease name of a bacteria. Okay, so paratyphoid does not refer to the bacteria; it refers to the disease. Okay, like COVID, we called it COVID-19 is the disease, and the cause of that basically was by the coronavirus. Okay, so paratyphoid is caused very specifically, and that's really important to understand, by salmonella typhimurium, but specifically the variant Copenhagen. Okay, so pigeons can get salmonella typhimurium that's not Copenhagen, and they can get a different, just an intestinal disease. But when you get true paratyphoid, and we're going to be talking specifically today about that typhimurium Copenhagen. Okay, so that's really important to understand. And Thomas, if I forget to mention on the diagnosis of this disease, please remind me that we need to be very sure of what we're dealing with. So essentially, this is a disease that's seen in many different species, but in pigeons, we refer to it then basically as paratyphoid. Okay. The disease is very much more prevalent, it would seem, and I still to this day believe it, in the fancy pigeon industry than in the racing pigeon industry. That's not to say that we don't see it in the racing pigeon industry and that it's not hugely important, because as we said before on the mycoplasma and on the chlamydia, it's one of the true carrier diseases. Okay, so along with those three, those are the diseases where it's very difficult, if not impossible, to cure your pigeons completely from it. If you have a completely isolated loft where there's never new pigeons coming in or going out or racing or showing, then it's an easier thing, and you may be able with paratyphoid to actually clear it, but you'll have to do some culling as well, and I'll explain that a little bit later. So effectively, it affects pigeons and many other species, but in pigeons, we basically see that it starts off as, maybe I must first say how is it transmitted. So it's a direct, the pigeon excretes the bacteria in the stool, in the feces, and very importantly is that it's a very hardy bacteria. So it's a resistant bacteria to environmental elements. So if there's anywhere where it's slightly coolish or where it's slightly moist and there's not complete desiccation and high heat over a prolonged period of time, the salmonella organism can actually survive very happily. Okay. And it's basically to such a degree that it's been said, whether this is true or not, that it can actually even survive boiling in some cases if it's not boiled long enough. So it's really a hardy bacteria. Okay. It sits very often on the areas around the food bowls where the pigeons are directly transmitting it from one pigeon to the other via the feces. Obviously, if it's stuck to their legs, etc., and the pigeons pick on one another, they can get it in such a way. But the one that I want to highlight, and I think most pigeon fanciers in South Africa actually has that concept again, but it's really important to reiterate that, is that the carrier of paratyphoid for pigeons is primarily rodents. Okay, so rats and mice are our major source of paramyxo disease being caused in pigeons. Okay, and the problem is that the rat and the mice have both developed a complete resistance to this bacteria's disease causing attributes in those two species. So a rat and a mouse will not get sick from paratyphoid. They will ingest the virus. It may cause a slight diarrhea, and it will then become septicemic and sit in the kidneys of that rats and mice. Okay, so whenever rats or mice urinate in your water bowls or urinate in unexposed food grain, and that bacteria sits on that grain, and it can happily sit on that grain for extended periods of time. Okay, so your biggest enemy, whenever I do the lectures, I've got this photograph of or meme of a rat with a sword and a thing as shield, and that's your biggest enemy is rats and mice. Okay, so one of the greatest preventative ways of fighting this disease is to actually minimize the exposure to rats and mice. Okay. So, and then unfortunately, many of the wild birds also will actually carry it in their feces, and if they do droppings from
Close by.
outside, you can get it in that way as well. Okay, so that's your source of the infection. It is transmitted via the egg. That's very important. And again, what I'm going to say now is very quickly to digress. 3 diseases will cause death in eggs or will cause young birds to actually die in the nest or shortly after being weaned. And those are mycoplasma, chlamydia, ornithosis, and salmonella. Okay, so if you've got babies dying in the nest, or you've got babies dying in the egg, or shortly after being weaned, think those 3 diseases. Okay, we'll talk very briefly about. Maybe I must just mention it here. The one other disease thing that can cause that is actually soiled bedding material in your nest pans. And I think you and I spoke briefly about the underfelt of carpets actually often being infested with E. coli or salmonella, or actually with stuff that they treat that underfelt with to stop the parasites and the dust mite, etc., and that being poisonous. So babies are born. Pigeon chicks are born with an open umbilicus, and it closes within 12 to 48 hours. It's exactly like horses, and the bacteria can gain entry in there, go into the yolk sac, and basically poison the yolk sac, and the baby will die shortly after being bred. So that's digressing. So what what happens with salmonella? A second, sorry.
No, please. If I can just ask you something quickly while you're having a break.
While I'm coughing.
Yeah, while you're coughing. A very well-known fancier in our area, Joe Gomes, I think you know him very well. And he's very anti-paratyphoid, very, and he's very
anal
about it, keeping rats out of his loft and all of that. And he maintains that over the years he's noticed that once the bird picked up paratyphoid or he's had it tested, and it develops a slight little growth on the foot.
Yes.
Do you think that's true?
Absolutely. So coming back to what happens is
Yes.
that the bird will pick it up, the pigeon will pick it up, and we're talking adult birds
Yes,
now. Okay?
yes.
And babies, adults, anything will pick it up. And in many cases, the bird will develop a diarrhea. It's not a very bad diarrhea. It's normally more a grayish, greenish, but not the luminescent green. They'll have a diarrhea, and we'll treat the diarrhea, and they'll get better, and that's fine. Okay. In some cases, when it's a very virulent strain of this Copenhagen, it'll then attach to the intestine. And this is really important to understand that that's what the probiotic bacteria actually do. The probiotic bacteria actually lowers, when they grow the good bacteria, they lower the pH, the acidity in the intestine. That inhibits the salmonella, E. coli, and other gram-negative bacteria that cause disease, but very effectively in many cases inhibits the salmonella from actually multiplying, and also inhibits the salmonella from actually attaching to the intestine, to the little cells in the intestine. The probiotic in another way will prevent that by actually themselves, the good bacteria, attaching there and then fighting off the salmonella and saying, bugger off, you're not going to attach here, go through, just move through, cause a bit of diarrhea or whatever, but move through, So that's the beauty of probiotics. And it's also the beauty of apple cider vinegar and many of these other sort of acidifying substances that we're giving. So that's a point in its own. But then what happens is, in some cases, high virulence, immunity that's not good, overuse of antibiotics that the salmonella is not being killed with, all of those factors play a role. And then the salmonella actually attaches to the intestine. Okay. Let me step back a moment and just say the other thing is when it's in the intestinal phase of salmonella, there are very preciously few antibiotics that's better than the furazolidone group of antibiotics to treat salmonella. Okay,
Okay.
so neomycin and furaltadone, furazolidone treats salmonella very, very effectively. Okay,
Okay.
but that's only in the intestine. And that's when we talk about salmonella treatment very briefly just now. You've got to remember that. It's only in the intestine. Because why? Neomycin, furaltadone, furazolidone is not absorbed by the intestine. It works only in the intestine. Okay. Neomycin slightly, but furaltadone and furazolidone only in the intestine.
Okay.
So once this bug is attached there, it then starts causing damage there and then gains entry into the bloodstream of the intestine. Okay. And from there, it then goes into the liver because the intestine drains into the liver. It then causes micro abscesses in the liver and it can sit and stay in the liver and cause liver disease. Okay. But for some reason or another, this Typhimurium salmonella paratyphoid is a master of deception. It basically evades the immune system. And then it very often spreads to the kidneys, very often spreads to the joints, often spreads to the brain itself, and in some cases spreads to the ovary of the pigeon. Okay, to the ovary itself. In other words, it sits there.
Yes.
We do not know that it spreads to the semen in male
In
in
males.
cocks. Okay,
Okay.
to the testes.
Yeah.
It's not been proven. Some people think, some don't. Okay, so effectively there it's now sitting. Okay, and now it's hiding away from the immune system. And where's the place where it can hide away? The best is inside the joints because it gains entry into the joints and causes damage there, and the joint gets inflamed and swells up, and basically the connective tissue forms around the joint. And now when the bird becomes a bit active again, it's a little bit of it passes back into the bloodstream and it does the whole thing again and again. Okay, and that's why it's so incredibly difficult to treat salmonella effectively. I've left out it may go to the spleen and it may even go into the lungs as well. So it can go into any of
Anything.
the
So,
organs.
so is there no? You've mentioned the furaltadone medications, and you say that's only in the intestine.
Yes.
Is there no medication that one can give that can go into the bloodstream and
That
then attack the?
Perf- Fantastic question, Russell, and that's exactly what we're trying to aim for. Okay.
Okay.
So what I'm saying then is there's no sense if you're treating salmonella paratyphoid, which is already in the joints and in the liver and is to treat with furaltadone or 4-in-1, anything that
Anything like
and
that.
think you're going to do that effectively.
Okay.
You're going to kill the bugs that's in the intestine, and that's also very important because they'll always be there as
Yes,
well.
yes.
So you want to kill them, and that's the beauty of using furaltadone.
Yeah.
So what did we do in the olden days? And if I talk about the olden days, it was the late 1990s, early 1990s, sorry, 80s, 89, 90, 2000. Baytril came onto the
Yes.
market. Okay, and Baytril was like a godsend. I mean, it just basically was the most incredible thing because it literally killed all the bad bacteria. I mean, it was just like a shotgun. If you grabbed for Baytril, you knew you were going to be okay. Okay, and everybody
Including
jumped,
the good bacteria.
including the good bacteria.
Okay.
Very important, fantastic, very very good point.
Okay.
Very effectively the good bacteria as well.
Okay.
Okay. So we overused, the whole world overused Baytril. There is
Okay.
no doubt about it whatsoever. Okay. So Baytril was then proven that if you at that stage used Baytril at 2 milliliters per liter of drinking water, that's 4 times the recommended dose.
That's the strength of the 10%.
Of the 10%.
10%.
Exactly. Good point again. Of the 10%. 2 mils per liter of drinking water. 4 times the recommended dose. Okay. You would then effectively be able to clean round about 75-80% of carrier pigeons with Baytril
Yeah.
for 10 days treatment. Okay.
Okay.
So that was the godsend again. We treated for 10 days with Baytril, and then shortly afterwards, and we'll talk about the vaccine now, we vaccinated, and we vaccinated 2 weeks later again. Bob's your uncle, problem solved. Okay. Now what has happened in the meantime? Two things happened. Number one, the resistance against Baytril has increased exponentially. Okay. So Baytril is definitively not the treatment of choice anymore. Okay. And let me be quite emphatic about it as well. High dose trimethoprim, um, the Theraprim, Mediprim, Avioprim, those high dose trimethoprims are good. They're really good bacteria, but they're certainly not the best for salmonella, for
Okay.
paratyphoid either. Okay, so we know now Baytril is not uniquely successful anymore.
Okay.
It's adequate, but it's not fantastic like it was.
Okay.
But then the second problem started appearing. We realized as time went on that when you treat large breed dogs with Baytril, they develop joint disease. Okay. We realized that basically, if you're going to be treating any animal where there's an immune compromise and there's fast replicating cells, that caused a problem. And suddenly, lo and behold, we started getting infertility in cocks, in the male, in the cocks, pigeon cocks, and in breeding birds as well, aviaries. And definitively, we now know that if you're going at the 4 times dosage for 10 days, you will be causing infertility in some of your cock birds. Okay.
Irreversible or
Irreversible damage, because
okay.
what's happening is that it actually kills. Baytril targets the fast reproducing cells, almost, remember, like we said, the circovirus, and it actually kills the seminal, the little structures that produce the semen
Okay.
in those
So it
cocks.
kills
Okay,
it.
it kills it, and you're getting cocks of 4 years old that are becoming sterile. Okay,
Okay.
so Baytril has its place, definitively has its place. You sometimes get E. coli's that are susceptible to nothing else, but in my mind, you treat with Baytril only if there is the proof that that bacteria is susceptible to it, and you can go at the normal doses of 1 to 2 mils per liter. 1 milliliter, half to 1 mil per 2 liters, sorry, 1 milliliter per 2 or 1 mil per liter. When
Okay.
you go to that 4 times dosage, you're starting to run into problems.
Okay.
Okay. So then we had to go and look, what can we do for this salmonella organism?
Yeah.
And it really took me a long time of this way and that way in every single way. So the typhoid cure, aviotyphoid cure, is a combination of furaltadone, which will kill it in the intestine very effectively. It contains high levels, high dose amoxicillin, and the reason for that is that you do have many salmonella organisms that are still susceptible to amoxicillin, so highly effective at those high doses.
Okay.
But what's the disadvantage of amoxicillin? The disadvantage is that it doesn't penetrate organs very well, okay, especially into the joints, into the brain, into the ovaries. Okay, it's great for lungs, it's okay for intestinal tract and liver. So what you want to do is get the advantage of the amoxicillin. That's a quick kill, very effective bactericidal. It kills the bacteria in the blood. Okay, so you're killing it in the intestine, eliminating it from the bloodstream and from the susceptible organs. Okay,
Okay.
so now we still sit with a problem, because what are we doing for the rest with the rest of the organs? Okay, what do we use? And the only sensitive alternative was to add chloramphenicol to that treatment regime, because the chloramphenicol universally penetrates into the brain, to a much higher degree into the joints, into the ovary. So that's why it's a 10-day treatment of the combination. You're hitting them with feraltadone and feraltadone, amoxicillin, killing it in the blood, and then with a 10-day extended period of treatment in those joints, you're hoping that the immune system that does get to the joints, but in a lower amount, will actually take care of those residual bacteria.
Okay.
So it's a
Interesting.
3-way synergistic treatment. Okay.
Okay.
And unfortunately, I don't think we're going to have time to talk about the compounded products and etc.
No,
But
no. But
maybe that's a story.
just quickly, if we can just touch on two more subjects. One is obviously the prescription, which typhoid cure is
Yes,
one. How do fanciers go about getting
getting those. Yeah.
the prescriptive
So,
ones now, and which are the prescriptive
okay,
ones?
yeah.
And then you, I seem to think, well, I did see an Econo range, and Avio Econo
Yes.
range.
Yeah.
If you can just touch on those two
Okay,
first. Then.
perfect. So essentially, on the prescription products, that is also a newer development that's happened in the sense that basically Act 101, which the two acts we've got 36 and 101, and these products that were allowed under under Act 36, many of them have actually now been taken and said that it's only allowed on a prescription, and
Okay.
they're actually enforcing that very, very strictly. Okay.
Okay.
So your general antibiotics for now, and I don't even want to go there, but because they're trying to, or they're going to be changing that apparently also in time. In Holland and Belgium, you can't even
Can't, I
buy
know.
ranitidazole. You can't buy
Can't buy
anything
anything.
without a
I know.
vet prescription.
Yeah.
So let's hope, because I don't think it's fair that it goes that way. But currently, there's some of these antibiotics that we're not allowed to sell in the pet stores anymore. And basically, we've got to do it on a prescription basis only. So we have what we call the client patient prescription module. So a veterinarian is allowed to prescribe a medicine to somebody that is his client, of which he knows the flock. And in that case, the flock is the patient. The flock becomes the
it's the
patient.
patient, yeah.
Okay. So if the pigeon fanciers go onto PigeonVet, www.pigeonvet.com,
We'll put that up,
put that
Harris.
up, please. That is a online ordering platform, much like Takealot, etc.,
Yeah.
where they can order the normal anti-parasitics, the dewormers, the coccidia products, some of the antibiotics like doxycycline, which is still allowed, and all the vitamins and nutraceuticals,
Yeah.
simply by placing the order, giving their credit card, and it's
done.
shipped to them.
Yeah.
If they want to order the prescription products, they have to then register as a bona fide client of mine, and we basically ascertain whether he needs that product or not. Okay. And if it's ascertained that it's needed as a preventative or a specific treatment, we will then ship that to him on my prescription.
You'll prescribe that.
So that is the client-patient model that we're following at this moment.
Okay,
in time.
okay.
And those medicines are compounded, mixed specifically then for those clients that need them on the prescription basis.
Okay.
So on the paratyphoid, we just want to finalize there. So we're saying you're doing rodent control, and basically stimulating your immune system with the probiotics and trying to prevent the bugs from adhering there. You're limiting stress itself, and then basically you're going to, if you have the disease in your loft and you know that the disease is there, you start in the beginning of the season, before the breeding season, with a 10-day treatment of typhoid cure. Currently, that is emphatically, in my mind, still the best treatment.
Okay.
And then if you can get a hold of an inactivated bacterial salmonella specific typhoid vaccine, you vaccinate them, and very, very importantly, 2 weeks later again. Okay. With the bacterial vaccines, you have to do a booster vaccine. It means nothing to do a single vaccine. So if you are in the lucky position that you've got a salmonella vaccine, you need to do it, and do it 2 weeks later again.
Why that, Doc?
Bacterial vaccines are lower in their antigenicity. It means that they're lower in causing an immune response. The virus itself, vaccines are better immune response givers. The bacterial ones are less so. And basically, when you do the first vaccine, it brings the immunity up to a certain point. It's not yet protective at that point. When you're doing the second one, it bumps it over that protective level. The same in some degree holds true for viral vaccines, but bacterial vaccines, it's non-negotiable.
Okay.
You're not doing any good by doing a single vaccine. You may partially protect them for a week or 2 or 3, but you want long-term protection for at least 8 months to a year, and then you'll have to annually do that.
Okay. Excellent.
So it's 10 days typhoid cure. In that time, I would use Rotaban as the immune stimulant to get maximal immune stimulation. On the 10th day, you vaccinate with a inactivated vaccine, and 10 days to 2 weeks later, you do the second.
And then would you use any probiotics and any candy statin or anything like that afterwards?
Afterwards, after the 10-day period, you go on to your normal Avio Intramune and
that kind of.
and the
Okay. And then Doc, the other question I had for you was the
The Econo range, yes.
Econo range.
Yeah, we've had those available for a period of time. We're basically relaunching them under a new sort of a completely new range.
Okay.
And basically it'll be smaller again, like the Econo. It'll be smaller
Smaller quantities.
quantities
Yeah.
for the guy that really has a small flock or that
Yes.
can't afford to basically.
And he needs to buy
Exactly, and
what
those
he.
will be more of the older generation products, like
Okay.
the equivalent to Emtrol, the equivalent to some of the older products.
Oh, they still work and
Exactly, there's
and
still
they
a
still
need
help
for
out.
it. Exactly.
And then you were going to mention the newer products that are coming
Yes,
out now.
so maybe we can just very briefly
touch on that. Yeah.
Will you just? I can start with a candida. So we've said that if you've got the specific problem with candida itself that is causing the disease and the resistant one, you're going to be using Candy Treat.
Yeah.
It's basically a combination of ketoconazole, which is the fungal medicine,
Yes.
along with the natural elements.
Okay.
And again, the fungi are very resistant prone. So I'm not saying in all cases, but it's definitively more effective than nystatin. Okay, so nystatin is a much older element.
Is it only a 1 day usage?
No. That's a 5 days. So you
5 day.
make 3 to 5, but preferably 5 days. So that's a 5-day treatment. Then,
Okay.
And that's when you're getting the grey colouring in the swallowing pipe and typical candida symptoms, specifically in croppers or in the babies when the guys are hand rearing babies.
Yes.
Or when you're treating and the guys, every time they get the smears made, the candida is still there. You go and you use the Candy Treat.
Okay. So that's one of the new
Yeah,
products.
the Avio Liver Boost is a powder formulation of the equivalent to Leverstim, of the MedPet Leverstim, but we put it into a powder formulation for the simple reason that we've added 3 very important elements to it, which Leverstim doesn't have.
Okay.
We've basically included choline, which is the Sedocol, and all the European liver support products. It's a fantastic liver support element.
Yeah.
We've included the artichoke extract, the Cynara, which you do get in an extract, but it doesn't work well in an extract form with ethoxylic acid. So it's a powdered, high quality powdered Cynara. And then we've included also the thing is, one of the plants, licorice. There's licorice as well. Okay. As a further immune stimulant and an antioxidant. Okay. EB12, Multivite EB12 is our first water soluble vitamin, and it includes all of the standard stuff that the product, like the general vitamin products, would do. It doesn't contain minerals, so it's not as broad in its spectrum as Multivite and Multibreed. But for the guy that wants to do a water application, that's a really very nice one. And then there's about 6-7 others, which we can touch on at the next place. But it'll be available, and we'll talk about it again on the WhatsApp group.
Okay.
And it's on the website as well.
Okay.
So,
Okay. It's a Doc from Russ Jr. and myself. Really like to thank you. I can't say how much we appreciate you making some time for us, and especially for the pigeon fraternity. It's and also just getting out to the people your knowledge, and with how much authority you can define certain products and certain aspects of diseases which are rumors and which are not non-factual, and that you've done clearly here today. So I thank you very much for that, and hopefully we can do this soon again.
Absolutely, and from my side also, thank you, my friend.
Thank you very much.
It's been an absolute pleasure.
Thank you.
And you also, Russell Jr. Thank you, my friend.